Welcome back to Different Facets of Happiness. Today, we're looking at a unique path to wellness with Karese Laguerre. Karese is an expert in orofacial myofunctional therapy and the founder of the MyoSpot. Karese has dedicated her career to helping individuals optimize their health by addressing breathing, sleep, and overall oral function. Carese's holistic approach empowers people to live happier, healthier lives. Karese Laguerre up next. Good afternoon, Karese Laguerre. How are you?
I am well. How are you?
I am well, and thank you very much for joining us on our show.
Thank you for having me. I'm very excited about this.
So am I. So, just to give our listeners some background, you are a certified Reiki master, a myofunctional therapist, and I'll ask you about that soon as to what that is, because I know a lot of listeners don't know what that is. You're a mother of four, an alternative health practitioner. Your private practice, the MyoSpot, is now a leader in the quest for myofunctional therapy awareness and public education. You have authored the book Accomplished, which is about sleeping education, sleeping better, eliminating burnout, and execution of goals. Your personal mission is to transform and positively impact as many people as you can through dynamic health, brain, and body work. So, as I mentioned earlier, my first question is what is myofunctional therapy and how does it help?
Myofunctional therapy is kind of like personal training in the simplest analogy I can make. But it's like personal training for only the muscles below the eyes but above the shoulders. So what I do is I work with those oral facial and some of those oral pharyngeal muscles to help strengthen and coordinate them. That way we can get proper function. Because when there's dysfunction in that area, we wind up with a ton of problems. So whether it's jaw tension, pain, strain, poor muscle patterns, tongue thrust, tie, we get a lot of different issues that kind of manifest as a result.
Why is the tongue so important in health?
Oh my gosh, the tongue is just important in life. Like our brain, our heart, and then the tongue needs to be like third most important organ. The tongue absolutely is an organ. Everybody likes to think of it as just like one muscle. And there's this common myth that it's the strongest muscle in the body. It's actually comprised of 8 different muscles that are in pairs. So there's 16 muscles. And those muscles all have to work together in a similar pattern to how an octopus's tentacles work or an elephant's trunk. So it works collaboratively to help our tongue move and manipulate. And then all of those muscles, when they come together, when we're at rest, it's helping us to breathe. When we're eating, when we're chewing, when we're just managing our saliva, it's helping us to swallow and process. It's the very first phase of that digestive process. The tongue is also a key player in some of our vagal tone regulation. And so anybody who's big on like cranial nerves, the vagus nerve, that's our regulator of our fight or flight, our autonomic nervous system. It's incredibly important, a big player in that as well, too, for stimulation in the mouth. And the tongue is just critical for all aspects.
So, what is the truth behind the tongue tie fad?
Oh, man. So we hear a lot about tongue ties and how tongue ties are overdiagnosed, and it's just a fad at this point. And, it's just popular in now, like bell bottoms were, and then it'll be gone. But that's actually not the real thing. What's actually going on is that now providers are becoming more aware of tongue ties. So tongue ties are really when that string that connects the base of the tongue to the floor of the mouth is restrictive in nature. So the tongue can't fully mobilize. So you can't get all the beautiful benefits of having the tongue up on the roof of the mouth to stimulate the nasal floor, to stimulate the vagus nerve, to get up and out of the airway so that you're not snoring at night or dealing with obstructive sleep apnea, for better eating and digestion and so forth. When that tongue can't mobilize, there's issues. So now we have more providers than ever who are well versed in it and are able to release it in a way that is more than cosmetic, it's functional in nature. And so while I know the media is dictating it to be a fad and something that's only for infants, it is throughout the lifespan. There are a lot of adults who are finding that their head and neck, shoulder tension, all of that is really tying into their tongue tie, inability to really catch full breaths when you feel like, sometimes you really can't catch your breath fully, or your breath is only you're feeling it in your chest and you're not feeling it deep in your gut. That might be related to the tongue tie. And it's really important that we start addressing it for what it is. It is something that is an important diagnostic criteria. And so, truth is, it's not a fad.
You mentioned something earlier about infants. So when it comes to new parents or guardians, what should a new parent do if they feel like their baby is tongue-tied?
I love that question. I'm so glad you asked, because what typically is starting to happen is that they're going straight to a release provider. So whether that's an ENT, their physician, or it's just dentist, a general dentist who has a laser and is going to release right away, it's really important to visit a functional specialist first. So a big part of why we're getting a lot of the media about this being a fad is that most of these new parents, they're so wound up in a bunch of emotions. I mean, they've just had a baby, and then now breastfeeding maybe isn't going as well as it should, or the baby's really colicky, and then it's been put to a tongue tie. And immediately you want to address it right away. But the best way to address it is actually to see a functional specialist first. So you want to contact a speech language pathologist, an occupational therapist, a feeding therapist, a IBCLC, who is a lactation consultant, or you want to contact a myofunctional therapist. Any one of those are really your best first call, because they're going to guide you in function. So not all the time what we suspect is the tongue tie being the culprit is actually the real problem. Sometimes the baby just hasn't coordinated the musculature well yet and needs further work with a functional provider, and perhaps we can avoid surgery altogether. So first step, see a functional provider.
And what would be the implications of not addressing this?
If you don't address it, there's a myriad of things that can really manifest. So my crystal ball doesn't give me exactly what might happen, but you could develop sleep issues, respiratory issues. You're more likely to develop some allergies and, more sensitivities to certain histamines. And you're going to have issues that will manifest in a range of things, from as small as you're just not able to take as full a breath, all the way through to like obstructive sleep apnea and, cardiac issues and so forth. So it's a spectrum of things that could manifest.
Okay. Now, what role does self-care play in myofunctional therapy? And how might this self-care contribute to a personal spiritual journey?
Oh my gosh, self-care is so incredibly important. So there is the mind-body connection, and I am a big believer in that. What manifests physically for a lot of us sometimes is a part of what's going on cognitively. And it's important for us to be more whole cognitively. So to work on mental health, to work on your mental status, and to keep yourself self-regulated in a way that is positive, so that when something does manifest, you're able to address it in a way that you can really fully heal as a person, instead of just healing what might be going on as like outward symptoms, but never really addressing the root cause, some of the mental issues that are going on deeper within. So self-care is incredibly important. I think when there's a lot of people who struggle with sleep, or you struggle with breathing or digestive issues, first thing you want to do is you just want to go for, let's get that resolution right away. But there's a lot of work that can be done, whether it's energy work, whether it is just, reflective, meditative work that can help with some of those issues. There are people who struggle with sleep who, instead of going straight for medication or sleep studies or so forth, you could just start working on your meditation, eliminating the light and the blue light that you have going on around you. And you can really start to heal from within. And you might notice that you get results that start immediately once you start addressing some of the self-care and taking care of your mental needs first.
Of course. So how can myofunctional therapy be integrated into a broader health regimen to support physical and mental well-being?
I love that. What a great question. Myofunctional therapy can absolutely be brought into the whole system. So there's a lot of manifestations, as I touched on earlier, that can come from having poor oral function. And when you have issues that are stemming from a very similar root cause, a lot of the mouth body connection is a big thing as well, in addition to the mind body connection. But having myofunctional therapy, whether it's just as light as having a therapist who has some exercises or who is able to teach professionals some exercises that can act almost like a triage of care to start out, it will help prevent us having these larger differential diagnoses that we wind up with more palliative care. So I think that myofunctional therapy would integrate beautifully if we are able to give people a light dose, because at this day and age, everything, what's not a free trial or something to sample, or you know what I'm saying? So you get a light dose of some of the benefits of just having better oral function. I think that would lead us into some of the domino that would be, okay, this is just the tip of the iceberg. What can we get if we get more?
Exactly. So I understand that your son had ADHD. How did you treat your son's ADHD naturally and overcome the myth of medication?
So, yes, my son was diagnosed with ADHD, but as far as I'm concerned, that was a misdiagnosis. So, I'll tell you a little bit of our story. So, I have 4 children, and he's my oldest. He's been disappointed every time I've gotten pregnant since, because it's 3 girls after him. But I remember we went to kindergarten and we're talking to the teacher for the first parent teacher meeting. And she is like, I love him. He's a wonderful child, but he will sit while we're in circle time or we're trying to read or we're trying to get the attention of all the children. He will sit and he will stare at the little, those little dust particles that float in from sun's rays and you see them through the window. Yeah. So he will sit there and he will find one of those and he will watch it float all the way down, his eyes very attentive, and you can't recall him and you can't get back his attention, right? And she's like, I think there might be something going on here, but let's just kind of watch it. And I'm like, okay, lady, like, I think you're going a bit far. He's 5. Who wants to pay attention? He is 5. First grade comes along. It's the same conversation that we're having again with a new teacher and different issues. And she's trying to get his attention. I'm like, okay, but he's 6. Like, he really doesn't want to pay attention and learn math. Like, he'll be fine. And you repeat this conversation a couple of times, and we get to 5th grade where I couldn't ignore it anymore. And his pediatrician was starting to make some remarks about it too, based on what we had told her was going on with some emotional and behavioral outbursts and, lack of control that he had at home. And so right around 5th grade, he was struggling and it was looking like he probably wasn't going to make it through 5th grade or might have to repeat it. And we said, okay, we have to get him to a neurologist. So we waited 6 months to see the best pediatric neurologist in the state of New Jersey. And once we got in that appointment, I'm telling you, she spent 15 minutes with us. I promise you it couldn't have been any longer than that. Yeah. She asked a couple of questions. Does he do this, do that, do that? It was like a test. We did the little yes, no, yes, no, yes, no. And she's like, yep. ADHD, gave us a script for some medication, and we were on our way. And it was like we waited so long for that.
And within 15 minutes, she was able to.
15, that was it. That was it. So we had the medication and, we found that nothing was happening with that medication. So we got another script. We called in and we said, hey, this one isn't working. Okay, great. We'll give you another one. Sent in another script to the pharmacy. We pick up that prescription. That one's not working. But she's like, give it a little longer. Okay. So we waited about a year with that one. When we go back for our new visit, it's not working. 3rd script. At this point, I start to fall into the rabbit hole of what's going on with the oral facial musculature and how that impacts sleep and breathing and restoration. And I went back again. And at this point now, this is our 3rd visit with her. I think we're visiting her like first it was 1 year and then it was 6 months, every 6 months because the medication wasn't working. So we go back for our 3rd visit and I'm like, look, the medication really isn't working. And I think I want to look down other paths. I really want to look and check into his sleep because I'm learning that there's some stuff there. And she right away was like, whoa. You never told me that he had sleep issues. If you told me, then we could have addressed this totally differently. And I'm thinking to myself, we spent 15 minutes together where you asked me a bunch of questions and not one of them was how was his sleep? Okay. And this is why this is important, the sleep. So the sleep is incredibly important because there is a 70% overlap in the symptoms between children who don't get good sleep, who are suffering from sleep deprivation, whether that's, they're not able to sleep, or when they're sleeping, they're not getting true restorative sleep, and ADHD. And we have to remember that she did nothing wrong with her questionnaire. Her questionnaire is how we diagnose ADHD. ADHD is not something you go get blood work for. There's no MRI, CAT scan. There's no way to say, oh, yep, that's the gene for it. You've got ADHD. It's all based on symptoms. Right. But there's a 70% overlap of symptoms with sleep. And so when there is something that's so large of a differential diagnosis, and when there are so many things you can do to help with sleep that are more natural in nature, it's absolutely imperative that we start having more of these conversations about how we can help families avoid what might not be true ADHD. So that's not to say that some people do very much have ADHD, but a 70% overlap, there's a good chunk of people who might be on medication that they don't need, and there's sleep that can help them instead. So that's my lovely journey with my son. But just to kind of wrap it around to where we are now, that's when he was in 5th grade. He is 20 years old now, but at 17, he was able to graduate high school a year before all of his peers. So this brilliant child who was burdened by, this inability to focus, and he just could not gather himself together. Once we got over that hump, once we started incorporating myofunctional therapy and some of the energy work and so forth, when we got him really sleeping, absolutely brilliant and just flying through school.
Wonderful. I'm glad to hear that. Wonderful news. So how does myofunctional therapy get people off their continuous positive airway pressure, that CPAP machine that you see a lot of people using?
Oh, yes. So myofunctional therapy, like I compared it to personal training, I'm going to give another analogy now. Okay. So if we have somebody who has 6-pack abs, right, and we lie them down. Now, when we lie down to go to bed for sleep, first stages of sleep are muscle relaxation. And then we also have the forces of gravity that are now on us in a different dimension because you're not upright anymore. Now we're lying down, right? So as we get horizontal and things start to relax, the person with 6-pack abs, those abs don't go anywhere when they're going to sleep. Those abs are there, they're strong, they're tight, they're defined, they don't shift. We have somebody who has a beer belly, we lie them down immediately. We lie them down. Those people, not us, we lie them down. And things shift right away. You see a shift. It doesn't look the same. The beer belly doesn't sit up in the same way. So gravity has its first impact. And the musculature just isn't as defined. So it wasn't going to stay and remain the same in any capacity anyway. You want to think of that as like your upper respiratory tract. So when you have musculature that's not well strengthened or defined in that area, that's kind of loose, or some of the ENTs are calling soft palates floppy, which I'm like, that can't possibly be a medical term, but I've heard it too many times, floppy. And you lie down to go to sleep, and then gravity puts down pressure and muscles start to relax, and they were already floppy to begin with, and they start to relax. Now you're at more of a risk for that area collapsing. It's not going to hold itself upright. And so when we have the CPAP, that is pushing air, keeps it, maintains the opening. Right. Whereas, what if those muscles were able to sustain themselves up, just like 6-pack ab would be able to sustain itself, right? So myofunctional therapy exercises and works all those muscles to really help to facilitate more patency. We want it to be able to be a self-sustaining system. Most of our throat and where we are breathing in our upper respiratory tract is soft tissue. And if we don't work on that soft tissue with the same level of dedication that we're working on the rest of our body, shoulders down is everything people go to the gyms for, right? If we don't work on here with the same level of commitment, we wind up with things like snoring, where snoring is just the sound of air, meaning resistance as it's trying to get into the lungs. And we don't want, we think sometimes snoring is cute or something that's, just hereditary.
I can assure you. He loves me anyway, but still.
Oh, when you think about it the way it really is where like that's the sound of that person struggling to get air into their lungs. I think we would envision it entirely different and we would make more of an effort to resolve it.
So, having said all this, are there specific myofunctional therapy exercises that people find particularly effective in enhancing their emotional state or happiness?
With the tongue and the tongue being able to attach to the roof of the mouth and a light suction, we want that light suction to be from just behind the upper front teeth, so at the front of that roof of the mouth palate, all the way to the back to the soft palate to where it's the start of our uvula, the uvula, that dangly ball in the back of your throat. It's a start of there. What we want ideally is for that back of the tongue to be back there and connecting so that it can help with the connection to the vagus nerve and our ability to self-regulate, to emotionally regulate, and so forth. And so back of the tongue exercises, soft palate exercises, being able to facilitate the proprioception between the two. There are a lot of great myofunctional therapy exercises that people will recall or will go back to after they've finished a myofunctional therapy program. So I always like to do check-ins and touch-ups with my patients when they come and they're telling me that like, oh man, I always go back to that one where we were lifting the soft palate because it just makes me feel so good. Or I get my tongue up there and then it's up there for the rest of the day. And we're just smooth sailing after that. Anytime that you can get those connections going, you're going to feel great.
Of course. And that would improve your confidence as well. Absolutely.
Oh, yeah.
Can you describe how myofunctional therapy complements other holistic practices, such as nutrition, exercise, and mindfulness?
So, myofunctional therapy complements them because it reinforces a lot of those same principles and values. So, we're going to see a lot of conscious breathing, meditation, just awareness. A lot of that is really doubled down on in myofunctional therapy. I think myofunctional therapy as a whole supports a lot of different branches of either alternative medicine or traditional medicine because we're able to really get to, we're starting at breathing. We are the upper respiratory tract. We are like the key to a lot of other pieces of the puzzle. And when things are wrong here, it manifests in a multitude of ways. And because we start getting people internally reflecting on what's going on and how they're carrying their body, how they're managing their musculature, it really does reflect and trickle down into other things, their nutrition, their mindfulness, their ability to be able to sit in quiet and meditate. It really does start to get all the ball rolling for everything else.
Really does. So, what are some questions that people should ask themselves when considering myofunctional therapy?
The biggest question I would ask myself if I was considering it is that, how is this impacting me day to day? So poor oral function, I think a lot of people, when they're thinking about it, you're like, it's your tongue, like whatever. I could just probably find some exercises on YouTube, or mewing became this big thing. But a lot of times that's not really addressing whatever your particular problem is. There's over 100 muscles in this wonderful group below the eyes, but above the shoulders. And in 100 muscles, if you can't pinpoint what your exact issue is, you might be exacerbating muscles that are already overdeveloped and then causing yourself more pain or more things that we have to unwind. So I would say, how is this really detrimental to you on a deeper level? Because you have to find your true pain point. I'll give you an example. So I had one patient who was 16 years old, and, for her, you would think it's something that's like aesthetic and so forth. It's had nothing to do with the aesthetics. Having the oral dysfunction, having to have braces, that's common. She's 16. It was how it was impacting her ability to eat and digest. And she couldn't go out with her friends and sit down and like have a meal or have people over, or she didn't even feel comfortable sometimes with her family at meals. And so it was a deeper, personal, everyday thing. And when you're thinking about that, I think it makes it easier to commit to what would be a lengthy muscular routine doing myofunctional therapy. Because like I said, it's kind of like personal training just for all the muscles that, nobody's paying attention to above the shoulders. Just like if you wanted to get six-pack abs, the dedication and work that you would have to put into that, you have to put into all these muscles up here. And so finding your true, like I always say it's always at least 3 layers deep. Like, this is your problem. This is what you're experiencing. If it's snoring, okay, what's the snoring really doing for you? You're not getting good sleep. What's that lack of good sleep really doing for you? Well, you haven't been promoted in 3 years because you haven't been able to like really show up the way you want to. That's now we're getting into the nitty gritty of what the real problem is. So what's the deeper issue?
I made light of the snoring earlier, but it can be a serious thing. And I think people now today are definitely paying more attention to this now. So Karese, thank you very much for coming on the show. This has been very educational for myself and, of course, for our listeners. Thank you so much. How can people reach you?
Well, thank you for having me. Number one, people can reach me. You can find me on Instagram, TikTok, or Facebook. I am at the Myo Spot on all 3 of those platforms. You can also find me on my website. I offer free consultations. It's themyospot.com. And yeah, those are the best ways to really reach me, find me, and learn more.
Wonderful. Thank you very much.
Thank you.
A heartfelt thank you to Karese for joining us today and sharing her powerful insights on how something as desirable as improving our sleep and breathing can lead to a happier, healthier life. You can connect with Karese and learn more about her transformative work at the Myo Spot. And remember, happiness isn't something that you chase. It's something that you can create with each breath, each thought, and each moment that you choose. Thank you for listening to Different Facets of Happiness. I'm Jackie Denise.